And a warm welcome to Dr. William Barnes of Tri-Rivers Healthcare in Salem, Kentucky, discussing the TIFF procedure to correct acid reflux. And Dr. Barnes, we've been visiting this procedure now for about several years. Are you still seeing a pretty good success rate for your patients?
Yes, sir. I'm telling you, we've been doing this since 2008, and it's now a very popular procedure, and actually has been proven by the Mayo Clinic to be a successful anti-reflux procedure. It's actually safer than the standard operations, and it's very, very effective. It lasts long. We have patients that are almost 15 years out now that are still not having reflux, not taking medication, and are doing very, very well. And it has actually led us into several other things. The device itself has been fashioned by the people at the Mayo Clinic to be able to do other surgeries with it. And they have actually trained us, Dr. Patton and myself, to do a procedure on the stomach for obesity surgery. And it's an endobariatric procedure, similar to what is called the sleeve. And it's done endoscopically with the similar device that we use for the TIFF that sutures just like we do the TIFF, except it sutures the stomach so that 80% of the stomach is now closed and you only have 20% of the stomach to be able to absorb your food, and those people lose weight very effectively. And it's the Mayo Clinic people have studied it, and they did a study that's published in a very prestigious magazine called The Lancet, and it shows that they do lose weight. It lowers their sugar, it lowers their blood pressure, it helps their bones and things like that, so that when they go to have a knee replacement, they're able to have it done and able to get on with their life. And we're very, very, very happy with it, and we find it very effective for our patients.
Well, we have about a minute left in this segment, Dr. Barnes, so let's talk about the safety concerns. Are there any numbers with the traditional gastric bypass that can be compared with this device that's similar to the TIFF procedure?
Okay, the TIFF procedure has been, like I say, proven by the Mayo Clinic to be very effective. They did a study and they found that the Nissen fundoplication had about a 20% complication rate over a year, whereas the TIFF patients had none. And we have found over the many years it's extremely safe, and our patients do very, very well, and their reflux is stopped. They're off their medicine in 2 weeks. And as far as the bariatric surgery, they had done that study during the summer, and there were absolutely no deaths, and there were only 2 minor complications which required an overnight stay, but there were no major complications, and the patients all lost weight, their sugars improved, their blood pressure improved, and they're doing that because they feel that maybe the eventual treatment for diabetes and hypertension in these obese patients instead of medication.
Certainly sounds like a great alternative. Can patients call you directly for an appointment?
Yes, if they'll call our office and talk to Roxanne, she'll get us an appointment to see either myself or Dr. Patton, and we'll go over the entire operation with the patients and give them their options.
Dr. William Barnes of Tri-Rivers Healthcare, our guest on today's Family Health Experts, with a great alternative for those who are wanting to lose weight. If you would like to review this or share this segment with someone, it'll be online in just a bit at WPSDLocal6.com.